If you've been following my channel for a while, then you know that I had strabismus surgery last year and I had pretty good results. Today, I want to talk to you all about how those results are sticking and what my experience is like 1 year after strabismus surgery. We all know that strabismus surgery can get great results right at the beginning, but a lot of times as time goes on, those results don't stay. So that's what I'm going to talk to you about today. I'm going to answer some of the frequently asked questions I get about my strabismus surgery. The first question I want to talk to you about today is the result from surgery holding? So when I went in for surgery, my eye was actually pointing way out here at 35 degrees of exotropia. After the surgery and suture adjustment, it was about sitting around 18 diopters when I was looking in the distance and 10 to 12 at near. So that means that it was about half of, but in the opposite direction. And now today I just had a progress visit a couple of weeks ago, and my eyes are now at more like 8 at distance and 4 to 6 at near. So my eyes are actually getting better and better with time. The second question I get asked a lot is, did the surgery give me 3D vision? The answer to that is going to be no for 98% of people, because surgery is all about aligning the eyes and making them look straight. It's not going to teach the brain how to use the information from both eyes and form it into one 3D image. Like, that's way more complicated than surgery. You can't get that in one day. That's something I've worked on achieving over 2.5 years in vision therapy. So no, the surgery did not give me 3D. I have 3D because of all the vision therapy that I've done. Now, the surgery did help me with 3D because my eyes are closer together, so I can focus on being relaxed and having my eyes be more straight in a relaxed position. And so that does make it easier to see 3D. But the surgery wasn't like this miracle overnight fix, and it won't be for almost anybody unless they got double vision from an accident or something like that, where they've had 3D in the past and the surgery aligns the eyes and the brain can remember how to see that way. But usually that's not the case. The third question I get asked a lot is, do I regret getting surgery, or would I do it again? And for sure, I would definitely get the surgery again. I mean, I have the aesthetic look here. I really enjoy having my eyes be straight, not having people look over their shoulder when I'm talking to them. Like, it's all fabulous. But there is one thing that I would do differently. And I'm not like living in regret and I don't lose sleep over this, but because there are people that might be considering following the same path, doing vision therapy and surgery, there is one thing that I would recommend. And that is that when you have the surgery, talk to your surgeon about leaving your eyes just a little bit out. And the reason for that is when you're trying to teach your brain to use both eyes, it's much easier if your eyes are in an exotropic position. So that means if one eye is a little bit out, that's way easier than if one eye is a little bit in. Obviously, ideally, they'd be perfectly straight, but that's like finding a needle in a haystack when it comes to strabismus surgery. They're not going to be perfectly straight usually. And so erring on the side of a little exotropic would have made the vision therapy part much easier. But I'm going to make it work with what I've got. But that's just one little thing that I would probably have done differently. But I would have definitely had the surgery still. I am so grateful for the benefits that it's given me and my peripheral vision, and there's so many things that have gotten so much better. The last question that people ask me all the time is, should I get surgery? And this is totally a personal choice, and it depends on if you want surgery, and it depends on what your goals are. Do you want to have your eyes be straight? Do you want 3D vision? If you're going for 3D, you're definitely going to need vision therapy to be part of this process. Usually you do vision therapy, then surgery, then more vision therapy, and that's where strabismic adults get the most success. Some people don't care about that part. They're like, I'm blind in this eye. I just want to look normal. And for them, go for it. Give surgery a try. It might not last as well because your brain doesn't know how to use both eyes together. But even having it last for 5 years, as we all know, is amazing. It can make a huge improvement on just daily living. Another option, if you're trying to decide whether or not surgery is right for you, you can get help from me. I actually offer consultations where I go through all of your specifics and kind of help you decide and find the right surgeon or vision therapy office depending on what you're wanting to do. You can find all that information at strabismussolutions.com on my website. Another thing you can do is I have an awesome quiz that you can take and that can kind of help you see if your eyes are working together or not. That's a big question people have is, well, I think I have 3D, or they don't know if they have 3D. Well, I have this quiz that has a few different tests that you can actually take and see whether you're using one eye or both eyes, if you're using them well together. And that's completely free. So if you go to strabismussolutions.com/test, you can do that, and it kind of gives you an idea on whether or not, 3D vision is possible. So all of that being said, my strabismus surgery, I think, was a great success. I went from having a horrible eye turn and having to completely force and strain to get my eyes to be straight. So anytime I was seen with 3D, I was straining and it was just so hard on my brain and it hurt. Now I can be relaxed and have a relaxed view and still see in 3D. It's so worth it for me. But you have to decide if it's going to be worth it for you. Thank you for watching today. Be sure to click the subscribe button so I can keep making these videos and you can keep learning everything there is to know about strabismus.